Thank you, Mr. President. I wanted just to take a moment to talk about the issue of pre-existing conditions. And there's been a lot of talk and legislation considered here recently. And I want to start by saying this. By most measures, the state of West Virginia is the oldest, sickest, and most impoverished state in our country. Now, that's not doom and gloom. That's a reality. And we're elected to face those realities here every session and during the interim session. Our Attorney General, Mr. Morrisey, has spent the better part of his career stripping away or fighting to strip away health care protections that protect West Virginians. But now I submit to you that he's the dog that's caught the car. And because of that, and because there's been some movement in attempting to dismantle the Affordable Health Care Act, he has jeopardized health insurance coverage for hundreds of thousands of West Virginians, and has now come to the people of West Virginia and said, well, wait a minute, we have a bill that will nonetheless protect folks with pre-existing conditions. Pre-existing conditions, for those who are listening, are health conditions such as pregnancy, heart disease, diabetes, and cancer. Conditions that afflict a strong majority, or not a strong majority, but a healthy minority of our citizens. In fact, 382,000 West Virginians suffer from pre-existing conditions, 37% of our population. Now, this bill that the Attorney General has pushed and has been introduced in this body, Senate Bill 284, is bad and wrong basically for three reasons. One, there's no accountability. It actually delegates the administrative duties to take care and provide insurance for people with pre-existing conditions to some nonprofit organization. I still can't follow that, because we're answerable to the people, but obviously nonprofit organizations are not. It increases premiums for folks with pre-existing conditions, and it does that in two ways. One, it puts everyone that has a pre-existing condition in the same pool. It doesn't spread them out with healthy individuals, but puts them all in one pool, which will raise premiums for those individuals. It does it a second way by allowing insurance companies to raise premiums on folks with pre-existing conditions 5 times. So if you're someone with diabetes and you're paying $600 in insurance a month, that means the insurance company can raise that premium to $3,000 a month. And finally, and this is something that's more apparent here recently, the Attorney General's bill, again Senate Bill 284, further burdens our struggling hospitals. Last summer, hospitals in Wheeling shuttered. Here more recently in the Kanawha County, Thomas Memorial Hospital has declared bankruptcy. And there are a lot of reasons for that. But I would submit to you that if someone with health insurance now, private health insurance with a pre-existing condition, and this bill passes, they'll fall out of the insurance market, and then they'll show up at Thomas Memorial Hospital in the emergency room. They won't have to pay for that care, the hospital will. And so it's burdening. That's a consequence of this bill. It further burdens our hospitals. And we can talk, and I hope we see legislation about potentially raising the reimbursement rate when it comes to Medicaid in our hospitals. But this bill is bad for hospitals. Our caucus, the Democrat caucus, has introduced a bill on pre-existing conditions that, in response to this Senate bill, will protect all those individuals with pre-existing conditions by not throwing everyone in the same pool with those particular ailments. So what I'd like today, Mr. President, is to say that I ask this body to not consider Senate Bill 284 and consider the Democrat bill and protect those individuals with pre-existing conditions. West Virginians must come first, and the Attorney General's bill does not do that, and we must restore our healthy communities. Thank you.